Our journey started about 7 years ago. After our wedding, 1 year, 2 years, we discovered we could not have a baby. Our first port of call was St. Catherine Hospital. A friend directed to the hospital. And when we went there, like the pastor will tell you, the medical equipment were designed to discover fault. And once you go, there are bound to be a lot of faults. At the St. Catherine Hospital, a lot of issues were diagnosed. First of all, on my expert, the issue of low sperm count. On my wife expert, they say that
I was not ovulating.
Ovulation problem. So the doctor there commend the treatment, and we are there patiently and praying too. After all said and done, after series of treatment, it's okay. The ovulation is okay. Sperm count has improved. But almost a year again, nothing forthcoming. We went back again, the same hospital. This time around it was motility. And the doctor said that I have a low motility, which is about 58, which is supposed to be 60%. And I said, what do we do again? This time again, we are recommended to a test out of the hospital, and it was after the test, the doctor again announced to me that, man, I need to go for a surgery. And that surgery required a specialist, and the problem is they call it a varicocectomy that required a special surgery.
Motility describes the ability of sperm to move properly towards an egg. This can be thought of as the quality of the sperm, which is a factor in successful pregnancies. Insufficient sperm motility is a common cause of subfertility or infertility. Varicocele are abnormally dilated spermatic cord veins that allow retrograde blood flow to the testes. Treatment of varicocele is considered in cases where patients experience infertility, pain, or testicular atrophy. Surgical varicocelectomy is a minimally invasive and highly effective approach to the treatment of varicocele. The operation can typically be performed in under 1 hour, and recovery is brisk, with most men returning to work within 1 to 2 days.
They did a confirmatory test. The doctor said, okay, everything is okay, 60%, perfect, kudos, it's okay, everything okay. I was so happy somehow. After some time, 3 months, 6 months, 9 months, 1 year again. This should be getting to 4 years, nothing yet. And I tell my wife, man, this hospital, I don't think they know what they're doing. We need to change a hospital. From St. Kathleen, we moved to L. Johnson. We started over again. That's what we're doing. Like the doctor will say, organized treatment. You can go for one test. That test have triple tests inside and double. Before you know, you have gone to about 12 tests altogether. We started there. So many drugs. At times I look at the drugs that I'm taking. I say, wow. In a dose, in morning, you can take 14 drugs. Each different. My wife, the same thing. And at the point, I discovered stuff that my wife is not even taking the drug, packing it somewhere. And I said, baby, what's the problem? Not this drug, I saw you stocking it somewhere. Yeah, man, this drug, I'm tired of these drugs. I said, man, personally to me, I was taking it religiously. Believing God that. Stayed there for about 1 year. Because they were measuring us on 3 months basis. The first 3 months, no result. Second 3 months, no result. third, fourth, 1 year has passed. I'm talking 5 years, nothing. So at this time we say, no, we're not going to any other medical. Let's try IVF. And we made up our mind. We went for the seminar. And one thing they told us in the seminar that the chances is 25%. I said, wow. With faith, I say, man, we'll be among that 25%. We did all the necessary tests. They carried the IVF, the this and that. And after they certify, we can go in for the test. The process of IVF commenced, and the treatment we are progressing, and we are making excellent report. We are coming out of it, and we are so optimistic. At least even if it's 10% chance that you are going to be among them, based on the report, the doctors and nurses. But along the line, and the embryo or the egg came out, there were 6 that were okay. They said, how many do you want? I said 3. Even if it's triplet, I can take care of them. With high energy, with high enthusiasm, with strong faith,
and
great expectations. Everything proceeded successfully, but along the line, doctor in their own ways, they came again. I think this time is implantation. Everything, they put the egg, the 3 of them, expecting the triplets, take care of them, no problem. Along the line, unfortunately, again, the doctor said, sorry, the thing could not implant. At this point, I made up my mind. I said, man, IVF have failed. And as far as I'm concerned, that medical aspect have failed me. And at this point in time, there is only one way now, and that is God. I have to. The only thing I do this time around, we took a joint decision that is God now. It's obvious now that everything has failed, and the only option, and there's not gonna be any plan B. The only option we have now is God.
Like he said, medicine failed, so we had to choose we have to surrender ourselves to God, that's spiritually. And I came from a Roman Catholic home. In fact, he was the person that really took me to Christ Embassy, as in he won me to Christ Embassy. Though I was kind of not really too serious, as in, but I knew when I came to Christ Embassy, I knew what the teachings were all about. I fell in love with the teachings, even though my immediate family, they were not really happy about it. But I told them, look, I'm married, so everybody should just be on his or her own. You should just leave me alone. In our 5th year, after when the IVF failed, I took in, lost the baby. That was when I now said, so God is really, in fact, God is at work. For me to even get pregnant, for me to be pregnant without any drug, without the artificial insemination.
But one day, I have already gone to the field. I text Pastor John. I said, please, we are married for 7 years and we have not gotten a baby. And then the person just called me immediately and said, why have I not told her such a thing? I said, no, it's okay. It's okay. So when am I coming back? I say a week starts. So when we come back, we'll try to see. So I called my wife and told her, look at this. Okay, no problem. That's beautiful. So I came back from the field. We went to her. We were with her. After the church service, she asked some questions to us, how long we told her. She prayed. Just a simple prayer, actually. And after I said, we go. But within my mind, I was like, this simple prayer. This prayer is very simple. Because I've got to a level that I'm beginning to quantify levels of prayers. This prayer, by the time you pray, I'll be able to say, this kind of prayer, that movement, this is a small prayer, this, because of my experience.
When you are feeling that it's like this thing will soon end, inside you you know that in fact everything will come to an end very soon. This challenge will soon be over. I had it very I knew that the set time is very near, it's so close. So I always sit at the second row. I always come to service very early. You know, when you are in need of something. In fact, I changed I don't go to church late anymore, and I make sure that I sit at that second row. And I never knew that pastor had been seeing my face. You know she sees everybody, but this my particular face. Even when my husband was introduced, I say, I know her now. I always see her at the second row. I say yes. Then that Easter conference, immediately Pastor Joy came up. In fact, it was as if the program was designed for me. As in, it was arranged. People might think that probably Pastor might have arranged to minister to. It was just like a connection. She just came out, and immediately she said, "Oh, you come out immediately." I came out immediately, and that was the first time a pastor laid hands on, as in a pastor laid hands on me. Immediately after that administration, I knew something. The set time is now. After May, then June, I didn't see my period again. I missed my period. Like joke. I went for test. It was positive. I repeated the test again. It was still positive. So I just relaxed. As in, I had this conviction in me that this one is going nowhere. Without any aid or support from the doctors. It just came, just like that.